On today's episode, we talk about telehealth and all the great benefits of having a pediatrician in your pocket. Today on KidzDocTalk.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the director of telemedicine at Pediatric Associates.
Hi, everyone. Welcome to our very first KidzDocTalk podcast. I am so excited to be doing this. We've been wanting to do this for a really long time, and we have some awesome ideas for future podcasts coming up. We're going to talk about all sorts of different topics about child health and pediatrics and what sorts of things you should be talking about or thinking about talking about with your pediatrician, and hopefully answering some common questions you have. I'm also looking forward to having a few special guests on the podcast as well. So I'm really excited. And this is kind of our very, very first podcast. If you have any ideas or suggestions, things that you want to hear, please leave some thoughts in the comments or send us a message on Facebook or Instagram. So the first thing I want to talk about today is something that's super near and dear to my heart, which is telemedicine. So telemedicine used to kind of be this thing that no one really knew about. It was kind of confusing and challenging to explain to people what I did. When I first joined Pediatric Associates, I was actually the third pediatrician hired for the telemedicine program. There were just 3 of us. And now, almost 3.5 years later, almost every single clinician in the practice does telemedicine to some extent. And certainly after COVID, one of the things that we've really seen happen is telemedicine has absolutely blown up, not just for the practice and not just in pediatrics, but I think in health overall, really in healthcare. We've seen that become a lot more popular. And now when I tell people that I do telemedicine, everyone really seems to understand and know what it is. So one of the huge advantages of telemedicine, especially in pediatrics, is we're able to lower the barrier of care. So not everybody has access to a pediatrician, and certainly not everybody has access to a pediatrician that lives in their pocket on their cell phone. So that's what I really love about telemedicine in the way that we do telemedicine here at PA. It's like having a pediatrician best friend in your pocket that you can just call and FaceTime and show pictures to that can kind of help navigate any questions you have about your child's healthcare. When I was a brand new mom and I had a newborn, I remember we were getting ready for our very first newborn visit with my daughter. And I was kind of used to just walking out of the house. I was an adult, and anytime I needed to go somewhere, I just did. And I remember getting ready for that very first newborn visit. It was like 7:30 in the morning. It was those really, early morning newborn spots that the office has. We were getting ready to go to Skylake to see Dr. Bennett. And I remember just frantically packing up all her stuff and all the paperwork from the hospital and packing up her bag with blankets and diapers and wipes and an outfit and a pacifier and a bottle and I don't know what else. And I think that's when I realized, wow, it's really hard to get out of the house with a newborn. And then as she grew up and, she would get sick and get fevers and get stomach bugs, it's really challenging to get those kids into the car seat, right? And out the door, and they're not feeling good. And it's really, really a challenge. So one of our goals is to kind of make it easier for parents who have newborns or who have kids who are sick or who just have a general question about their child's health. Not all things require an in-person visit. A lot of things we can help take care of virtually. And certainly when something does need to be seen in person, we can help accommodate and schedule that. So what can we do on telemedicine? So one of our main goals is really to try to keep kids out of the ER who don't need to be there. And sometimes that can really be a challenging decision for a parent to make. How do you know when pink eye is just pink eye? How do you know it's not a deeper infection of the eye? How do you know this is just a fever or just a virus? How do you know that this isn't really an ill child or sepsis that is certainly an emergency and needs to be seen immediately? How do you know when fever is too long? How long is too long? How high is too high, right? These are all really, it's kind of scary and anxiety-provoking questions, I think, for all parents. And so telemedicine can certainly help navigate those challenges and help differentiate when somebody's okay to stay home, when we need to keep a little bit of a closer eye on them, when we need to send them to the office, and when this is truly emergent. So some things are obviously self-explanatory, right? Any difficulty breathing, any newborn with a fever, anyone who obviously is having a seizure or they're acting a little bit differently, what we call a change in mental status, those things, or, like a serious injury, obviously those things you don't need to call us for. Those are very clear indication to seek emergency care. And then some things are kind of on the opposite end of the spectrum. Most rashes certainly can wait, right? Most newborn questions, if the newborn is acting well, can wait. We're happy to see those on telemedicine. But what we see, I think, a lot of is kind of those in-between, kind of gray zone things where it's not clear to the parent whether something is emergent, urgent, can wait to be seen, can be seen in the office, right? We can hold off on it. So those are things we can definitely see, assess, and help make a determination of what the next course of action is. We're also seeing COVID, a lot of COVID. So thankfully, for the most part, COVID in kids seems to have a little bit of a more milder presentation than we see in adults, right? For the most part, thankfully, we see kids doing very, very well with the illness. Certainly they're having symptoms, right? And they're having fever and they're not feeling so good. But generally kids seem to recover from this really nicely. So these are kids that we're absolutely making an effort to try to keep home. We don't want them in the office. We're trying to decrease our exposure to COVID in the office, both for other patients who are there as well as our clinicians. So I encourage anyone whose child has an exposure to COVID, maybe has even tested positive for COVID, give us a call. We're happy to follow those kids really closely, follow up with them, see them for several visits, make sure they're doing okay, give the appropriate guidance. The quarantine guidance can certainly be very tricky, seems to constantly be changing. We're happy to help answer all those really confusing questions. We're happy to give notes to return to school when appropriate. But again, that's really, really something that we're trying to capture on telemedicine instead of necessarily sending to the office, and certainly not the emergency room. So how does it work? So if you are a patient of Pediatric Associates, you can just call your regular PA number.
855-395-8471. That's 855-KidzDoc, kids with a Z.
And you can make a telemedicine appointment 24/7, day or night. In addition to scheduling an appointment, you can do an on-demand or like a walk-in visit. Super duper easy. Just go on your phone. You're going to download the KidzDoc Now app, Kids, KIDZ, Doc, DOC, Now, NOW. Free app in the App Store. When you first log in, you're going to register with your email and your child or children's information. You can put any number of children on your account that you want. And once you do that, you'll see that the app has several options depending on what geography you're in. If you're a PA patient in one of our South Florida offices or near Tampa or Jacksonville region, you'll see designated doors for you. If you're not a PA patient, we're absolutely happy to see you. There's a designated kind of door or option for you as well. Once you enter through that door, you'll have an option to choose clinicians. You can choose somebody who's a first available and you kind of just get in line to be seen. Or if you have a specific doctor, nurse practitioner, or PA that you're familiar with in the practice and you see them available on the platform, you're definitely welcome just to get in line and wait and specifically request that we don't transfer you and that you see that person. We're always happy to accommodate the kind of patient and pediatrician relationship. We really respect that and uphold that. Once you're in the waiting room, you wait. So unlike when you're waiting in the doctor's office and you're around other people and you're around other people's germs and other people's kids, now you are waiting in the comfort of your own home. So I say that because we do ask for a little bit of your patience. We have a lot of clinicians on the platform and we work quickly, but we are busy and we like to give each patient all the time that they need. When we're seeing patients who are non-PA patients, like patients who are brand new to us and that we don't necessarily have all the medical history for, we're going to get the time to get to know you. We're going to take the time to get a full history to make sure that we're giving the appropriate guidance. This isn't just an urgent care that you walk into and we're just going to treat and get you out the door. We really want to make sure we're providing quality care. So that means that if you're in the waiting room, you need to wait a little bit. Again, in the comfort of your own home. So just like you kind of have your smartphone and you're in the waiting room, walk around your house, do what you need to do. As soon as we are ready, we will connect with you. The only thing we ask is that you have the child with you. So even though a lot of visits seemingly don't need us to actually see the child, it's really, really helpful for us to be able to assess them. And babies, we can make sure that baby's nice and happy, well-fed, calm, and hydrated. Older kids, the same thing. We can assess their hydration status, make sure that their pain is well controlled. And then kids who are really older, who we can actually talk to, we can get a lot of information and get a lot of history from them. Even behavioral visits, like for kids who have ADHD or kids who are seeing us for some psychiatric concerns, it's actually very beneficial and important for us to be able to talk to them. So just like you wouldn't show up to the doctor's office without your child, please do not show up to a telemedicine visit without the child. Ultimately, that child is our patient, and we want to make sure that we see them to make a full and accurate assessment of the problem that you're here to see us for. So after the visit is over, once we've seen you, if we need any medication prescribed, we're happy to do that. We'll electronically send it to the pharmacy. If we need any follow-up visits scheduled either in the office or something more acute like the urgent care or emergency room, we can arrange that. We'll help you find the closest pediatric emergency room and call ahead if necessary. If we need a follow-up telemedicine visit, we'll schedule that as well. So everything will be taken care of before the visit ends. That way you know exactly what to expect and what follow-up is appropriate. We also have some really exciting programs coming up, not just for kind of these acute visits like rashes and pink eye, but also for more chronic things. So kids with chronic medical problems like asthma, ADHD, sickle cell, our teenagers who maybe need a little bit more private time and whose visits really need to happen sometimes without the parent. We're really hoping to use telehealth in these types of chronic disease management programs. It's going to help increase our follow-up and make sure these kids get the appropriate number of visits that they need to make sure that their diseases are well controlled. So that's kind of a general overview of what we do. A good general rule of thumb is that when in doubt, call us. If you're not sure if this needs an office visit, call us. If you're not sure if this needs an over-the-counter medicine, call us. If you're not sure what the dose of something is, you can call us. If it's not appropriate for telemedicine, we can always give you the appropriate guidance for where to go and arrange for that visit to happen. So that is all for today, my friends. Again, if you have any suggestions or visits or things that you want to hear on the podcast, leave us some comments and you can find us on Facebook, Instagram, as well as the KidzDocTalk Now app 24/7. Bye for now.